When Rakan came to me, he had things that he, of course, wanted to do to his face. He was interested in all of the things that we do. He did have some acne scarring on his face. He had a little bit of redness, dry skin. He used soap to wash his face. I think we talked about this, like actual bar soap. He did not have a skincare regimen or routine. He was basically skincare illiterate. It was not great.
It was not great. Oh my,
so
the gasps I heard in the clinic when I said I use bar soap. Oh my God.
It was horrible.
She's like, do not.
No. And sunscreen, I don't even think you ever.
Oh, never.
Never was sunscreen.
Sunscreen? What's sunscreen?
Yes. So, the first thing we did with Rakan was just an easy thing, Botox. But we also talked about what he has to do at home in his skincare regimen to make sure that he gets his skin where he wants it to be and keeps it where it is and when it's looking great. So we did Botox, of course, in his forehead, in the 11 lines here, and his crow's feet, because he did have a lot of movement. We have before and after photos too to show, and it's amazing how smooth his forehead looks, how he had static lines up there that were reduced and they're gone now. And then after that, we started talking about what he should do for skincare. So we have great medical grade skincare products at Wellness for Life that we use. So I kind of educated him on what will work best for him, and gave him a routine to go home with. So he started that, and he fell off a couple times, and life got crazy and got busy, and his skin reacted, and he saw it.
Yes, and that's the thing.
Yeah.
And I think, I don't know if I mentioned this before, but the most important thing is consistency with your skin skincare. If you stop, your skin, this is how it happens. It'll just,
you have to keep doing.
You have to keep, and that's what happened. I mean, like life got in the way and things happened. We're going to talk about that in a bit. So when I stopped, my skin just looked really not great.
Yeah.
And then I went back on it again, and it was fantastic. And I've used. Have you guys remember Proactive?
Oh yeah, Proactive is horrible. Don't use that stuff.
See, that's the thing. It's like I was like, oh my God, it's going to be the same stuff.
No.
Again, I'm an uneducated human that came for you guys for help, and when I started using your product, oh my God. I mean, seriously, it's really, you guys, you can't feel my forehead, you can't feel my face.
Right.
The texture has changed. I had really horrendous rosacea. I took medication for it, but the redness didn't completely go away.
Right.
But with the products, with the and the procedures we did, it really helped out with that.
It did, yes. So other things we did with his face, just for skin texture, plumpness, acne scarring, just overall, glowy, plumpy skin, is microneedling.
Yes.
We did that series of 3 that we've talked about a lot, which I highly recommend for everybody, not only people who, just have skin like Rakan's, who have, deep scars that he's been dealing with for many, many years. I mean, even people with healthy skin. Yes,
so
go ahead.
I just want to say something, because I think a lot of people, honestly, I was one of them. When we did the microneedling, I thought I was going to see instant results.
Right.
And you don't. So don't get discouraged. And I really, really did. And I was like, oh, is this really working?
Yeah.
But no, I just said, no. Microneedling works over a long period of time. And let me just say, oh my God. I mean, when I say oh my God, I mean, oh my God. I had really deep scar tissue from my acne. I mean, really, it was not great. And I had a patch here that was really bad. But it's been I don't know how long it's been, but I really, it's been a while.
It has.
Yeah, but the results,
they last, and we'll do more procedures.
I mean, you see, your skin gets better with time. I'm like, how is this even happening?
Yes.
Because you're continuing your home regimen.
Yes.
And the other thing we did, Trish would microneedle, and then we would do a peel, and then microneedle and peel, because nothing stands alone. Everything works together, and to create this excellent skin barrier, because that's really what we're talking about. It's not just for looking at you and you aesthetically look great. Yeah, that is super, and we definitely want that. But it's actually creating a really healthy skin barrier, because our skin is our largest organ, super important, and it's really a great reflection of your health. When your skin is unhealthy, you are inside not doing so great.
Right. Yeah. So we did the microneedling with PRP. I always like to use platelet-rich plasma with microneedling, because it just has all those amazing stem cells It just kind of boosts your skin texture. It boosts those stem cells into, it's healing your skin. You're regrowing collagen. You're rebuilding elastin. You're doing all of these amazing things for your skin. So we did that, a series of 3, and then the series of 3 chemical peels. And then we started to work on just kind of giving him a little bit more definition and structure to his face. So of course, jawline is always a big thing for a lot of people, men in general, and then also, women want a nice defined jawline. So we did some work on his jawline, just injecting a syringe of filler just to give it a little bit more definition. And then we also worked on his mid-face. So his cheeks, we gave that a little bit of plumpness and a little bit, it's not so much a lift. You're not going to get a lift with a syringe of filler, but you are going to change that structure and contour. You're going to repair and rebuild what's underneath. So as we age, we start to, as you know, your fat pads start to separate. Everything starts to kind of go south. We lose volume. We lose that skin elasticity. So once we take that volume of filler and put that back into repairing the underneath structure, it gives him a nice, plump, refreshed, rejuvenated look.
I mean, as a customer.
Yes.
As a client, because I was
as
like,
a patient.
Yeah, as a patient. Oh my God. Yeah. As a patient, the procedure. So when we did it, so the really interesting thing is that people's faces we talked about, they're not the same. So the procedure, and because we're being fully candid here, so it went flawless on one side.
This side was perfect.
Yes,
easy.
perfect. And I'm not kidding. It was like seconds. Within seconds, it was done. Perfect. Again, what I really like about the clinic that I'm working with is that they actually really care about your safety. They follow the procedures. Yes. So Trish made sure that you didn't want to touch, what is it called?
So you have a major artery that runs across the jawline here. And it's very important. This is a no-go zone. And this is one of the things that we talk about a lot at Wellness for Life too, is just the training that I do myself for injecting filler and neurotoxins, anything that I do. Facial anatomy is super, super, super important when you're injecting. So I do study the facial anatomy. I know where I should be injecting, what plane I should be injecting into. It's a continuing education thing. It's not just a one thing that you learn once and then it's done. So he has this artery here that it's in a different area than it is on most people. So it was just a little trickier to get those injections in, but I think that it made Rakan feel comfortable knowing that we were very diligent in looking at his structure and making sure that it was done safely.
Oh, absolutely.
And this is one of the reasons, that you don't want to go places that are not licensed to do injectables.
Back alley,
like you don't want you don't want to go, like your injector should be an RN, a nurse practitioner, a physician, somebody that actually went to school for this. You don't like your friend, Jellybean down the street, that got something offline. You don't let them inject your face.
Oh,
exactly. That is not okay.
Yes, that is totally not okay. And although so this side took a lot longer, but it was fine, and it wasn't bad at all. It's just that it took longer because she took her time to make sure it was done correctly.
Yeah, and talk about how the injections felt. What did you feel?
I don't know if I'm an anomaly because Trish loves me.
Yeah.
I don't feel anything when she does anything on me. I mean, she has. Oh my God! So I would never do. Honestly, I would never do anything with anybody else but her because she has very magical hands.
She has magic hands.
That's what I'm going to call it.
And she's a very gentle injector.
Yes, extremely
gentle.
gentle.
She is not stabbing at your face.
Nope. It doesn't hurt. So, and I like that she tells me what it's going to feel like. Oh, this is going to sting a little bit, but then when for example, lidocaine will kick in, you won't feel anything. And I was like, oh, okay, there's a little sting. Nothing we have done honestly bothered me. I mean, like I said, I don't know what it is, but I really was not. I think she's very gentle on me. I love it. I would honestly not want to work with anybody else.
Right, and I want everybody to be comfortable because it is nerve-wracking having needles poked into your face and things like that. It's not something that generally feels great. So I do my best to make sure that you're comfortable during the procedure. I do educate people on how it's going to feel, what's going to happen. The whole process is laid out in front of you, so there are no surprises.
I'm laughing. The last time, what was the last thing we did? Was it the
lips? Yeah.
Lips? And I was like, "Are we done?" did you do anything?
Yeah.
She goes, oh my God.
Which
yes.
is not the normal response, yes, but a fantastic one. Well, I also want to say, you know, when we were talking about education, and Trisha's education in particular, is one of the advanced things that she's learned is to inject with a cannula. And so what this means is that instead of, so needles are sharp, obviously, so when you inject with a needle, we absolutely do not want to go into the blood vessels in your face. Absolutely do not want to do that. So with a needle, it is easy to poke into one of those blood vessels and not realize it, but with a cannula, virtually impossible. Not to say it can never happen, but pretty impossible. And so that's one of the advanced things that Trisha's learned, so that when she's injecting your filler, we're doing it as safely as possible so that you're getting amazing results, but with the minimized risk possible.
Right. And some areas required, you know, directly onto the bone with a needle, that's just going to give you the best results. So it really depends on the person's goals, what, you know, what your aesthetics goals are. It depends on the person's face, your age, your ethnicity, everything goes into that. So like I said, I just make sure that everybody knows before you sit in my chair what's going to happen, what the procedure is going to entail, and how it's going to work.
And I really like that you explain, oh, this will feel like this.
Yeah.
This will feel like this. So you don't, you know, you're like, oh, it's, you know, what's going on. But so you kind of explain it. And I mean, it really put me at ease.
Good.
And it was, I mean,
Because you want to be comfortable.
I know.
As comfortable as possible. Yeah. And then also, you know, we've talked about this a number of times, but I'm going to talk about it again. This idea of filler and these overfilled faces that we see.
Yes.
So sitting here right now, looking at Rakan, he has 5 syringes of filler in his face.
Yes.
So, and he does not look like a cartoon character. He doesn't look like a clown. You probably didn't know, if you've seen him day to day, that he got this filler because we just subtly changed the structure and brought him back. So like Trish was saying, as we age, we lose our fat pads, we lose our bone. And I think like the best analogy I've ever heard is like your skin is like a tablecloth and the table's just getting smaller and smaller. And then so filler just brings that table back out. So it's not, we didn't make you look like you didn't look before. It's just this is how he used to look. And so it's very subtle. And Trish does not overfill. That's just not a thing we're gonna do.
Yeah, and I mean when we talked about this, like, you know, the first thing when you guys mentioned the filler, I'm like, oh my God. You
were nervous.
Yeah, well, because people, that's what we perceive. Like we see people on TV with, I mean, I had to say duck lips and stuff like that.
Hot dog lips.
The buns.
And I'm like, what, you know, I don't want that. And, you know, everybody has a right. I mean, that's scary. I mean, I shouldn't judge. And let's say that.
Sure.
You know, I should. Sorry.
Maybe that's what they like.
Yeah. So
but
that's
not
fine.
what we like.
Yeah, but and that's not what I wanted, and that would stop me honestly from doing anything that you know had anything to do with fillers.
Right.
And Botox too. Oh my God! I don't know why I thought Botox. I was so scared of it.
Yeah.
But then Trish explained to me, it's like, no, this is not. You know, it's different. And then you go through the procedure, and it's not permanent.
Right.
That's the other thing. It's not permanent.
So a lot of the things that we did on Rakan are completely reversible. Like the filler we can dissolve if we ever need to, which we don't need to. Right. But Botox only lasts 3 to 4 months depending on your dosage and how your body metabolizes it, what kind of neurotoxin you're using. So it doesn't last forever. If you hate something, it'll go away. I talk to Rakan about that a lot. Often, you know, it's just like, well, we can try this thing and see how you like it. If you don't, it's going to go away, and we don't have to ever do it again. So. And
when we did, and it's hard. It's one of those things, again, hard to explain. There is a difference, but you'll notice it, but you won't notice it.
Yeah.
Does it make sense?
It's subtle.
Yeah,
it's a subtle improvement.
Subtle. Right. I mean, when we did the lip fillers, a lot of people didn't know.
Yeah.
But I can tell. I mean, I love it. I can tell the difference. But a lot of people are like, you know, it's like the little thing that you look fresh today.
Yeah.
You know what
Did you get some good sleep last night?
Did you get some good? This is what we're going for.
Right.
It's just looking fresher. We don't want to change the way you look.
Absolutely. Or it's like, you know, a lot of people that do not think aesthetic injectables are the thing for them, but they wear makeup. So it's very similar in that, like you just want to enhance yourself with a little bit of makeup. No, you don't need to go crazy with everything. Right. And it is the same with injectables. It is just enhancing what you naturally have. And there's nothing to be afraid of. Again, Trish is highly educated in this. And one of the things that we had talked about before that we find, I don't know if I want to use the word funny, but interesting, thing is that Trish will recommend a therapy, I will recommend a therapy, and then people come back and say, well, I talked to my neighbor, I talked to my niece, and she doesn't think I should do that. And unless your neighbor or niece is a practitioner or an injector, they almost surely do not have the education that we do. So whatever you do, you really want to go to a provider that has the education in this, because your Google search or anything like that is never going to give you the breadth of experience of actually going to a provider. Whether it's us, whether it's anybody, it doesn't matter. It's just that go to somebody that actually is certified in what they do. That's the key takeaway here.
Reputable too.
Absolutely.
Somebody with good reputation.
Yeah.
And I mean, it's just, unfortunately, it's what we see on TV sometimes that really puts these images in our heads and makes us really...
fear factor.
Yes, 100%.
Yes.
What I'm telling you, when you guys mentioned Botox, I was so scared because I've seen people with overly done Botox. I'm like, I don't want to be there.
And they may not have even had Botox. That's the other thing. Is a lot of people, what they think is filler, what they think is Botox, it's not.
It's not.
It's something completely different.
Right.
And so, it's really just that kind of myth of things. So what's next for Rakan's face?
So we're going to obviously continue doing neurotoxin on his upper face. We are also going to continue with microneedling with PRP. He's going to continue his skincare regimen at home.
Yep.
And then another thing I want to add for Rakan is going to be a little bit of Sculptra in his cheek area, his mid-face, and maybe a little bit of nasolabial folds just to kind of plump everything up. So what Sculptra does, it's an injectable, and what it does is it stimulates your body to produce its own collagen and elastin. So unlike a filler, where a filler is hyaluronic acid, which is also produced in your body naturally, but what that does is it goes in and it fills and it gives you an instant result. And over time, it starts to reabsorb into your body. You don't have the same results as right when you walked out of your appointment. With Sculptra, what it does is it breaks down the PLLP particle that is in Sculptra, and then that stimulates your body to produce collagen and elastin. So for Rakan, what I want to do is just give him a little bit more of that youthful plump that he has back, and just reinvigorate his face with that product.
And let me just say, I've seen the results.
Yes, they're amazing.
And someone
it's
that
incredible.
I know personally, I'm like, oh, my jaw dropped.
Well, we both have Sculptra.
Oh.
Yes.
And it is, and I love Botox, I love filler, I love microneedling, I love all of it. And but the Sculptra, just that plumpness.
Yes.
But you guys look great before. Like, you always look great.
Well, so did you.
It was subtle. It was subtle.
Yeah. But see, the person that I saw it on,
Astounding.
Right.
yes, because they had a lot more.
Well, a lot of volume loss.
Yes.
Right.
Yeah.
Yes,
And when you have a
yes.
lot of volume loss, it is dramatic.
It is.
For
And,
sure.
and it's not like it's. It doesn't look like they did anything, but it just looked like things like disappeared.
Just better.
Yeah, they look
Just
better. Like
better, for sure.
they didn't change. I'm like,
Yeah.
I saw them. I was like, oh my god.
They still look like them, but like we rolled that clock.
Yes,
Right.
Yes.
Yeah.
And
without
what it
surgery
does-
or without
yeah.
surgery or anything. I mean, going under. I
Right.
guess.
Yeah.
Yeah. So what it does is it just replaces your natural collagen elastin. It replaces that skin. Some people, have that skin laxity as they age. So there's a lot of, kind of droopy skin and wrinkles and static lines that are really difficult to treat and to make look good. And everyone thinks they need a facelift. You don't. Sculptra can help with that. And so I think we'll do, like I said, mid-face. We're also probably going to do a little bit more along the jawline and just kind of redefine everything. So
Sculptra is also a series of 3, like many
Yes.
things that we do. So 3 treatments about a month to 6 weeks apart, and you really see full results. How long?
about 6 to 12 weeks after your final treatment is when you're going to see your fullest results. And Sculptra can last up 2 to 4 years, sometimes even up to 5 years. So it's not something that you have to come back in. Some fillers only last 12 to 18 months, depending on the type of filler and where it's injected. But with Sculptra, it seems it just keeps building and growing and replacing that structure. So you're really repairing that underneath structure, not just putting a Band-Aid on it.
So exciting.
Yeah.
And then you'll keep doing your home care. You will
Oh,
never
absolutely.
wash your face with bar
Oh,
soap
God,
again,
no.
right?
Actually, truthfully, I have never touched a bar of soap on my face ever.
Thank God.
since
If
we-
anything was learned in the past year,
Oh,
that,
well, because I mean,
that I've done in my job.
I mean, really, the dryness
Yeah.
of my skin when I was
Yeah.
using a bar of soap, and I
Absolutely.
didn't realize it, which made things worse.
Yes.
I mean,
Yes.
and you don't realize it. I mean, we're like okay, we're men, you know, whatever, we can watch. And I didn't realize this. There's a lot of men that use skincare routines.
They do.
Yeah, and I was like, oh, I'm one of the few probably who didn't.
Yeah,
Now you
humans
do.
need to have their skin managed.
Yes. And
It's a funny thing about us.
yeah, and with with my skin, I have a very oily skin, and I didn't think, hey, I don't need to put a moisturizer on because it's oily. It's the actual opposite.
It is.
And again, that's why we go to my friends here so they can educate me about things that I'm ignorant about, and we turned out come up with really great results.
Exactly. Yes.
This is so exciting. And next we're going to talk about everybody's favorite topic, anxiety.